Welcome to our third video in the troubleshooting series, Finishing and Bite Settling with Clear Aligners. In this video, we will discuss how to finish your aligner cases and handle any poor tracking movements toward the end of the treatment, such as difficult rotations. We will also provide some helpful tips and tricks on how to address any minor residual spaces. In the latter half of the video, we will address poor tracking movements of extrusion, and finally, bite settling with clear aligners. To begin with, let's recall what refinements aligners are. Refinement aligners are extra aligner steps used after the initial treatment is done. These are intended to help complete the alignment and address any lack of tracking for certain teeth. It is important to understand that refinements are not uncommon with clear aligners. Furthermore, with advanced cases requiring longer treatment plans, they become even more significant. We should understand that the predictability of different movements with aligners could vary with multiple factors. This means that the final achieved result might not match the final results seen on the treatment plan video. Here are some factors that could affect the predictability of treatment. Patient's compliance. A decrease in the required aligner wear time may result in slowed or halted tooth movements, leading to a loss of tracking. In addition, difficult movements such as rotations of lateral incisors could result in lack of proper tracking due to their small crown size when compared to the treatment setup. Another crucial factor is the availability of enough space. Lack of space or having tight contacts, for example around a canine tooth that is being rotated, will definitely hinder the planned movement. Next is the rates of movements applied. Using high rates of movement in the treatment setup could lead to unwanted or poor tracking movements and eventually poor fitting aligners. Last but not least is not having enough force applied. This could be a result of poorly fitting aligners from impression quality issues or the loss of one or more attachments during the treatment. For these reasons, refinements are generally needed to finalize the alignment towards the end of the initial treatment plan. Let's look at how the process of refinement goes. First, new records need to be obtained, and the request for adjustment should be submitted through Eon Access. After that, the refinement treatment plan will be ready for revision and approval. Once approved, the new set of aligners will be shipped to you. In certain cases, only minor adjustments need to be done to finalize the treatment. We will look at these scenarios one by one and explain how to deal with them in a timely and efficient manner without the need for extra aligner steps. The first thing we'll discuss is poor tracking movements found at the end of the treatment. In this example, such as in rotation cases, scenario of poorly tracking rotation of an upper lateral incisor. Notice how the alignment of all teeth is finalized except for the upper right lateral incisor. The lateral requires additional distal out rotation to achieve proper alignment and match the contralateral incisor, ultimately improving the arch. To address this in clinic, use a pressure point made of bonded resin material placed on the mesial side of the tooth to facilitate its mesial in and distal out rotation when the aligners are worn. Start with the regular etching and bonding steps, as with any bonded restoration. Next, place a small amount of resin using a microbrush on the mesial labial surface of the tooth, as shown here, and light cure as per the manufacturer's instructions. The location of the pressure point can vary depending on the direction of the rotation. It is also possible to add 2 pressure points on the labial and palatal surfaces of the tooth if more pressure is needed. In this example, another point can be added distopalatally to facilitate distal out rotation as well. When aligners are worn, extra pressure will be applied on the mesial surface of the lateral incisor, and rotation will be facilitated without the need for an extra aligner. Another way of doing this is using the shown tool to create a small indentation or dimple within the aligner material to create a pressure point and facilitate rotation. Again, the location will be determined according to the intended movement. In this example, we will place it on the mesiolabial surface of the upper lateral incisor. Notice how the indentation looks on the aligner. This can be done using the last well-fitting aligner step and ensuring close monitoring of the follow-up with the patient until the required rotation is achieved. Moving on to another clinical scenario which is commonly encountered toward the treatment end, residual spaces. Look closely at the example case here. and notice the presence of minor residual spaces around the anterior and premolar teeth. You can verify the exact amount of space using a gauge. It is not uncommon. If the spaces are mild and no other significant teeth movement or alignment is needed, we can resolve these residual spaces in clinic using a power chain, without the need for extra refinement steps. To do this, we will start by demarcating the gingivolabial side where we want to cut the aligner. Note that this is only for demo purposes, and there's no need to do this in your office. You can simply visualize where the spaces are and you can either use scissors or a blade to do the aligner cutting. Place the aligners in and notice how the gingival third of the teeth is cleared now. This will allow us to place 2 buttons on each of the upper second premolars and fit a power chain. The power chain will apply a retraction force on the arch as a whole and facilitate space closure. Of course, this should be done with close follow-up and patient monitoring to avoid excess forces and Next, we will discuss how to tackle poor tracking extrusive movements. In this example, the upper right lateral incisor did not track well. Extrusion movement was planned to improve its level in relation to the adjacent teeth and the contralateral lateral incisor. Note, let's look at how bootstrap elastics can be attached. Start by demarcating the button cutouts areas on the labial and palatal gingival areas of the lateral incisor as shown here. Then proceed with aligner cutting using scissors or a blade to create the cutouts. Place the aligner on the teeth and ensure there is enough clearance. After buttons are placed, patient can be instructed to attach the elastics from the labial to the palatal button. Notice that ceramic buttons can also be used instead of metal ones for better aesthetics in the anterior segment of the arch. It is recommended to use 1/8 medium elastic. Moving on to the last part of our video, which is bite settling with clear aligners. Clear aligner treatments is a posterior open bite. There are multiple theories to explain its etiology. Mandibular advancement, in cases where the mandible is held in a retruded position due to a deep bite, such as in Class II Division II cases, which could possibly lead to anterior interferences, causing the bite to open posteriorly. Another hypothesis is that the thickness of the aligner material between the teeth will cause some posterior teeth intrusion from the biting forces applied. In growing patients, posterior open bites can be caused when there is prevention of normal eruption. If the posterior open bite is caused by anterior interferences, then the way to approach this is by eliminating interferences and creating some overjet, with either lower anterior teeth retraction or overcorrecting the upper anterior teeth labial torque. This will require providing new records for refinements. In other scenarios, when the posterior open bite is caused by posterior teeth intrusion, we can resolve this by cutting the last aligner distal to the canine or to the first or second premolars, depending on the location of the open bite, and allowing for natural extrusion and settling of the bite, while retaining the anterior teeth in place with the aligners. This settling could take a few weeks to happen. Close monitoring and frequent follow-up appointments are recommended to prevent unwanted movements like supereruption of the teeth, leading. Another way of doing this, especially if the resultant open bite is significant, is cutting the aligners distal to the canines or premolars and enforcing the posterior teeth extrusion with box elastics, using buttons placed on the posterior teeth, in our example here between second premolars and second molars. Elastics will apply extrusive. Box elastics can also be added using cutouts in the aligner as shown here. This can be part of the refinement plan, where extrusion of posterior teeth with the help of box elastics is planned in addition to any other movements that are still being performed on the other teeth. Buttons are attached to the teeth, and patients are instructed to wear the elastics during their aligner wear. In conclusion, remember that troubleshooting and problem solving with aligner treatments is not black or white. It is a skill developed with knowledge and expertise and will always depend on your clinical judgment. Thank you for watching.